In this video, we're going to demonstrate how to assess diastasis rectus abdominis. We also call this diastasis recti or just simply diastasis. So Amanda has had 3 pregnancies in less than 5 years, and she's 9.5 months postpartum from her last baby. So we're going to see how her core is functioning just simply from assessing down her linea alba, from her sternum all the way down to her pubic bone. Diastasis recti is a really normal, natural occurrence of many pregnancies. And essentially what it is, we have this connective tissue from the sternum down to our pubic bone. We have abdominal muscles that insert into that connective tissue, the linea alba, and they can simply separate and get wider apart during a full-term pregnancy. So the first thing we're going to do, we're going to have Amanda lying on her back. I'm going to have her bend her knees and place her feet flat on the floor, arms just beside her body. She's nice and relaxed here in this position. I like to assess from her right side of the body, same side every time I do this. I'm going to have her roll her shirt up, pants down slightly just so we can see a bit of the hip bone. And I'm just going to assess her skin and tissue quality. And what we're looking for is just the tautness of the skin, maybe seeing if we're having a lot of skin looseness, which is not happening on Amanda's belly. So from that, we know that her tissue quality is pretty good right off the bat. I'm going to feel with 2 or 3 fingers from her sternum all the way down through her linea alba, through the midline of her belly, down under her belly button a couple inches, not all the way down to the pubic bone. We don't need to go that far, but just as comfortable as you are assessing on yourself, as far down to the pubic bone. So I can feel just by feeling into her skin and her belly that she has good tautness in her connective tissue. I can't push really far down into her belly. I get this springing back that's coming back up against my fingers, and that's a really great sign. Sometimes I can push very far down, or you might be able to push very far down into your belly, and that just tells us that there's not a great amount of tension happening in this connective tissue, and that's what we really want to regain when we are healing a diastasis recti. So to really assess, I'm going to put 2 or 3 fingers just above Amanda's belly button. I'm going to cue her to tuck her chin towards her chest, and then slowly you're going to lift your head off the floor and come back down. So what we're feeling for when she does this is there's going to be these 2 ridges of muscle belly that are just going to hug against your fingers, the outside of your fingers. If you didn't feel anything, repeat this a couple more times and back down. Perfect. So I can feel that, but maybe I would need to add another finger or another couple fingers. We'll just do it one more time. And maybe you would feel those muscle bellies hug into your fingers then. So we'll play around with it a couple times, take away fingers, add fingers, see what you find. So in Amanda's case, we have almost 3 fingers separation of those muscle bellies that I can feel hugging in against my fingertips. So we'll move up. I like to just measure 3 fingers above the belly button, and we'll repeat. So tuck and lift and back down. Good, and one more time, I'm just gonna have you relax your belly. Yeah, and then tuck in again and lift, perfect, back down. Good, and while Amanda's doing this, we should note that you don't need to lift the head very high at all up off the floor. So tuck and lift, perfect, and back down. This isn't a crunch, it's simply a head lift. So we measure at the belly button, 3 finger space above, 3 finger space below the belly button as well. And we'll just make some notes on what we're feeling and what we're finding when we do that. So again, like I said, we have about 3 fingers at the belly button, about 3 fingers below, and really minimal above her belly button. And that's extremely common, especially when we've had multiple pregnancies. So we're gonna do one more assessment just to get a better gauge of that tension down the linea alba. So Amanda, I'm gonna have you take an inhale breath, and then on her exhale, she's gonna gently do a pelvic floor contraction, and she's gonna repeat the head lift, chin tuck and lift up. Great, excellent. So when she does this, I feel more tension back against my fingers, and that's a great sign. So when she does the pelvic floor lift, she's basically just thinking about lifting her vagina and anus gently up and into her body, like a Kegel, but extremely gentle. And we feel this co-contraction of her abdominal muscles when she does that. So that's great. We get more tension down the linea alba when she's co-contracting her pelvic floor and her deep core muscles. So one more time, we'll do it below. So she breathes into her belly and her rib cage, gentle pelvic floor, and back down. Great. And again, more tension there as well. So to assess diastasis recti, we're gonna scan the skin just to see the quality. You can feel just when you're relaxed down the linea alba. Then we'll assess the head lift at the belly button, above the belly button, and below, just with the head lift. Then we'll reassess at, above, and below with the gentle pelvic floor lift. And that's how you assess diastasis recti.